Hello over there. And you, and you, and you. Welcome to the Empower New Nurses platform. How was your day? Let me hope it was good. I'm Dr. Miriam Smith, the host for Empower New Nurses. I'm a mentor, nurse educator, bestseller, Amazon bestseller on the book Nurse, the guide to empower new nurses in the delivery of high quality care to all patients. I advocate for young nurses, for new nurses. I advocate for patients to receive high quality care, all patients to receive high quality care. And so today, I must give you a backdrop. I was talking to one of my former colleagues yesterday and just thinking about what should I talk about. And she's a nurse, lactation counselor. She cares so well for moms and their babies. I worked with her some time ago, and she's still working, but I'm retired, but not from my mental state. I like to share the knowledge I have. I like to share it with my young nurses who are coming on. I like to pay it forward. I like to pass the baton on. And so I decided that I would do a few episodes on breastfeeding. First, let me tell you that I am a nurse for many years. I've worked in different areas. I have cared for many different, diverse group of patients. I've also worked in academia. I also onboarded new nurses, also nurses who have been transferring or transitioning from one area to another. And so this area of nursing with mother, baby, daddy, I'm thinking more right now of the labor and delivery, postpartum, and the NICU. That's the neonatal ICU. So, why is it that I've decided to talk about breastfeeding? Many reasons. As I said before, I definitely will be zeroing on some episodes with breastfeeding because different times, different mothers, new babies, new situation, new issues. Sometimes, and many times, young mothers, they find it difficult to feed their babies. Some of them are ready to give up. I remember my daughter, she was trying to pump. It was frustrating, and although I am a certified lactation counselor, it never mattered at that time because I saw the frustration on her, encouraged her. I also took her to see some of my other more experienced consultant and counselor. And she did it for a short time, breastfeeding. But we know that there are benefits for mommies and benefits for babies. But this time, I'll just talk about breastfeeding and why it's important. I researched it. Apart from my experience, I researched it also. And said breastfeeding is not just for babies. Breastfeeding is a baby's first line of protection. Protection, it's rich in nutrients. It has antibodies and it comforts. It has a comfort that no other substitute can fully, underscore that, fully replace. Breastfeeding isn't just feeding, it's nurturing, it's protecting, and bonding is one act of love. Bonding. When that mom hugs her baby, when that baby feels mom's heartbeat, when that baby hugs, as it were, mom hugs the baby and the baby cuddles, it's an experience that you just have to feel for yourself. So, breastfeeding is more than milk. It, to me, it has a sacred connotation that shapes for a lifetime. And if you look and you listen and you observe, you will see that breastfeeding is, it matters. It matters, right? And when we think of breastfeeding matters, it's a gift that keeps giving. Breastfeeding is one of the first and most impactful gifts a mother can give. It supports the baby's health today, and it helps for the future well-being of the child. When a mom or a mother breastfeeds, she strengthens not only her baby's body, but her own confidence, healing, and maternal instinct. Have you ever observed, if you haven't had the experience, a mom with her newborn, when that baby is born, and the provider, the nurse or the doctor or whoever puts the baby on the mom, that smile that comes on the face, mom's usually asking, baby's normal? You know, it's a whole process. But those are some of the baby normal. 5 toes, 5 toes, 10 toes, 10 fingers. Baby is, in a fast time, real rapid time, the baby is being checked. Continue to be checked. That baby is placed on that mom's chest. I'm telling you, that baby is moving like lightning to the breast. That's one of the blessings that only the infinite knows. We don't understand it. We can't fathom it, but it's real. So to be in that labor room and to be able to see the process, it's a blessing. So we welcome our new babies. And unless there is a medical condition or medical conditions that will that the baby is not able to get breast milk, well, we have to see through that. But if you're able to, as a nurse, lactation counselor, I personally encourage that. And at the same time, let me hasten to say that if one is not able to, we're not putting you down. Whatever, the choice is yours, but we're encouraging you to do that if you're able to. I'm Dr. Miriam Smith, the host for Empowering New Nurses. And this is for nurses, but it's also for the general public. More information on breastfeeding. I'm sure I'll be coming with some episodes for breastfeeding. I spoke to a young mom recently, and she was feeding her baby, her little girl, so well. The little girl is doing so, haven't been sick. Not sickly, because, it helps to improve the immune system and stabilize that. So we're going to go through that in another episode. Benefits to mom, breastfeeding, and benefits to babies. Thank you so much for listening. And if you haven't thought of it, start thinking about it. Okay, you can subscribe on my channel. That's Miriam Amanda Smith on YouTube. On Instagram is Podcast Mayor. Website, Empowering New Nurses. I know you might know a new nurse. Encourage them to watch. It's all free. Watch, hear, I'll be providing some courses in the near future, but not at the moment. So buy up this opportunity, take advantage of it, and just do well. Thank you. Thank you. Next time.